there we go. So good afternoon, everybody. My name is Adrian Brown. I'm a Senior Research Fellow and Lecturer in Nutrition and Dietetics at University College London. By trade, I'm a Senior Specialist Weight Management and Bariatric Dietitian, and I'm now Co-Programme Lead for the new MSc in Dietetics Pre-Registration at UCL. And today, I'm going to be talking about some of the research that we did during COVID. Obviously, COVID had a massive impact on us all, whether that be work, our home life, but also it significantly impacted people living with obesity. At the start of the pandemic, what tended to happen was all face-to-face contact with people living with obesity that were in treatment stopped. And people were taken out of clinical practice and put elsewhere in the hospital. So it significantly impacted. As a result, we made a decision that we really wanted to start to learn about what we could do and understand how people were being impacted. So as I said, COVID-19 had an unprecedented impact on our lives. And what we found is that people living with obesity were identified as at higher risk of severe illness compared to the general population. The issue is that there was a significant issue around social distancing and shielding. And this resulted in concerns, particularly around social isolation and loneliness. What we also know is that food insecurity in people in the general population was around 10%. And I want you to remember that figure for later on. So this was people that are having low or very low food insecurity. And there were suggestions, and this is work from the Trestle Trust, that actually furloughing and unemployment significantly impacted on people of higher food insecurity and increased food bank use as well. So what we did is we did an initial survey. So what I did right at the start is we looked at the impact of the first national lockdown. And so this is our publication. I do encourage you all to go and look. It is open access. So this is in clinical medicine. And what we found is that mental health came worse or much worse in people living with obesity. We also found that health-related behaviours were significantly impacted. We noticed that in general, this was from our population, that around 55% reported unhealthier diets, 61% reported reduced physical activity, 72% reported dealing with their emotions with food, and a whopping 80% reported that their sleep had been significantly impacted during COVID. And we had reports of people on the front line reporting their sleep being significantly impacted following their experiences on ward. But also we looked at weight stigma. There was ideas that weight stigma increased. Did everyone see the before and after means? Before lockdown, after lockdown, highly stigmatizing. And there was a concern that actually weight stigma was increasing. However, in our population we interviewed, only 16.7% reported that it had increased. However, around half of them reported that they'd been either feeling stigmatized before and it hadn't increased and they just felt equally stigmatized. So what we were interested in is again, what was the continued impact of COVID-19 on people living with obesity? So what we did is we did another survey and asked patients to consider how they were feeling between July 2021 and when they filled it out between April 2021 and August 21. They did a survey with open and closed questions. And then what they did is they did questionnaires looking at mental health. So this is PHE 9, Warwick and Edinburgh, which is well-being, UCLA loneliness scale, and then the food insecurity scale by the USDA. So what do we find? What did we have? We had about 1,200 people complete the survey during this time. Their average age of about 38 years old. Around 62% were female. A median BMI of 36. The majority were from white British or Irish ethnicity. The majority lived in England. And around 40% had one additional risk factor in excess of obesity that predicted that they would be at risk of severe illness, whether that be, for example, type 2 diabetes. So what do we find out on mental health? we found out that around 50% of people reported that their mental health had continued to worsen during this time. Mean depression was elevated at 11.3 on the PHQ-9, and around a third of individuals reported moderate or severe obesity, depression. When we looked at mean well-being, again, this was low. This is out of 100. And around 60% of people reported having low well-being as a general point. But quite interestingly, around a third of the people were actually seeking medical treatment during this time. So what do we find out about loneliness? And this is where we really found out some interesting data. 61% of individuals actually reported feeling lonely. Out of a score of 9, the mean score for loneliness was 6, and nearly 30% reported high levels of loneliness. So really identifying that what was happening in the community was actually people were significantly being impacted by COVID. About 20% were reported very low and low food insecurity. Do you remember the 10%? So almost a doubling in food insecurity in people living with obesity compared to before the lockdown. And 8.1 reported very low food insecurity. This is from previous data in 2019, 2.7 times higher than we were seeing before. 3 key aspects of food insecurity that related to either people being unable to afford food or food not being available is that 13.5 reported that they're eating less than they should. 10.5 were reporting being hungry but not eating. And nearly 4% were reporting going a whole day without food because they couldn't afford it or they didn't have access to it. And this was greater than the general population, as identified earlier on. How did it impact on stigma? We saw very similar figures to what we saw during the first national lockdown, and there didn't appear to be a change. However, what did change is that people appeared not to feel as stigmatized. So we're unsure exactly why that happened, but maybe that was differentiation between the first lockdown and these memes and the large social media content, and that reducing over time. But those that were feeling stigmatized were, as you might expect, if you look at those data-related stigma, people were female, more likely to have a higher BMI, and more likely to have high depression. Those that were feeling less stigmatized were those with higher well-being. Really identifying that stigma and mental health are so implicitly connected, and that mental health can really impact on people feeling weight stigma. When we looked at health-related behaviours, this is where we saw some real change. Around 44% reported healthier foods. If you look at the healthier diet, over half of people were actually reported having a healthier food intake. Around similar amounts reported managing their emotions, but 80% of people reported actually attempting to lose weight. 61% reported actually no change in their alcohol intake, and of those, 45% reported reducing and 45% reported increasing, so very similar. 50% reported increasing their physical activity. And this might relate to actually the changing in what was going on nationally related to people socially distancing, having to stay in, and that changing period of time that was going on. Around 50% continued to report that quality and quantity of their sleep was being impacted. And again, around 80% reported worsening of their sleep during this period of time. So really identifying that people living with obesity, despite us saying, actually, your behaviours were worse during that first lockdown, we were really noticing things were changing. So what were our key home messages? People living with obesity are now attempting to improve their health related and being less significantly impacted than the first lockdown. Better well-being appears to be associated with people choosing healthier food intakes, increased physical activity and better sleep. Food insecurity and loneliness was substantially higher amongst people living with obesity. This really has implications for policymakers about supporting people in the continued aspects of this pandemic.
and really identifies the importance of supporting mental health. And also identifying that food insecurity and loneliness significantly impacted on people living with obesity, and we need to be thinking about as we start to transcend out of the pandemic and further on. I'd like to thank and acknowledge everybody that helped me, which is a large variety of people, always important, and the patients, importantly, and the people that filled it out. And I thank you very much. Any questions?